Healthy Choices, helping you live healthier. Sponsored by Intermountain Health.
1 in 4 persons will suffer a stroke in the U.S. Strokes are the 5th leading cause of death.
Intermountain Health and University of Utah Health offers some of the most advanced stroke care available. And here to tell us more in this sponsored interview is Dr. Paul Johnson. Now, those are some shocking statistics. 1 in 4 people will suffer from a stroke. Yesterday was also World Stroke Awareness Day. Can you tell us a little bit about what you're doing to raise awareness this time of year?
Yeah, that's a good question. So, of course, stroke is extremely common. As you mentioned, 1 in 4 people worldwide will have a stroke. So we're doing a lot of outreach as a healthcare system. We had an editorial in the Salt Lake Tribune yesterday highlighting the fact that stroke is common, but it is increasingly treatable. And there are a lot of new medications and treatments available to help prevent strokes from causing permanent brain injuries to people.
Ooh, the prevention being a big key. Can we talk about what some of those warning signs are when somebody is experiencing a stroke?
Sure. You know, strokes can cause a lot of different symptoms depending on what part of the brain is affected. But we use the mnemonic Be Fast to help remind people what the most common stroke symptoms are. And so in Be Fast, the B stands for balance problems, so sudden severe onset of imbalance, usually to the point that people can't walk. That could be a sign of a stroke. The E is for eye problems, so loss of vision suddenly in one eye, or more commonly, one half of vision, so either the right side or left side of vision. The F is for facial weakness or a facial droop. A is for arm weakness, so arm or hand paralysis that's sudden in onset. S is for speech problems, so either being unable to speak at all or your words come out as nonsense. And then T is for time, so it's time to call 911 and act quickly.
That's such a great way to list that out to know. I've had family members impacted by this, and it is really scary. Can you tell our viewers who is susceptible to stroke?
Well, you know, anybody can have a stroke. Even children can have strokes. That being said, stroke is more common in people over age 50. But despite that, 15% of strokes happen in people less than age 50, so it really can affect anybody. But age is a risk factor, and so
I feel like sharing those statistics, though, and this information is so important to spread the awareness. I had no idea. I'm learning a lot just in this segment. Let's talk about ways that we can prevent. I know time is of the essence when it's happening. So what can we do to prevent or to, I guess, lessen, if it does happen, maybe some of those lingering effects?
Yeah, of course. So most strokes actually are preventable. So the #1 risk factor worldwide for stroke is high blood pressure. So that's something that can easily be detected and treated. So high blood pressure is #1. High cholesterol, diabetes, smoking cigarettes, and air pollution are all additional kind of modifiable risk factors that people can address to reduce their risk of having a stroke.
Well, and at Intermountain Health, you have some new technology. If you are impacted by this, talk about some of those.
Right. So in the last decade, there have been a number of major advances in stroke care, which have really expanded the number of people that we can treat and the options for helping them to have a better outcome and less injury from the stroke. So this fall, the University of Utah and Intermountain Health both switched to a new medicine to treat strokes. It's called Tenecteplase, and it's a modified version of the older medicine that we used to use. It's easier to give, and it has better outcomes. Now, that medicine is very effective for stroke, but it has a very narrow 4.5-hour window from onset in which to give it. That's why it's critical that people come to the hospital very quickly.
What about the telehealth? How does that work with something that might be as time sensitive as a stroke?
Right. So because strokes are so time sensitive for treatment, the stroke field has pioneered telehealth. So it's very common for stroke neurologists like myself to be able to evaluate patients over a camera in a rural hospital. So many hospitals have a TV and video camera set up so the neurologist can see them, evaluate them very quickly, and help make a decision as to whether they're a candidate for that blood clot dissolving medicine that I mentioned, Tenecteplase.
Well, that is so cool that there is hope and so many resources and ways to treat and prevent stroke. Where can people go to find more information?
So I'd recommend either the Intermountain Health website or the American Heart Association website. They have lots of information about stroke risk factors.
Thank you so much. Great information today.
Thank you again to Intermountain Health for this sponsored interview.
Still ahead.